Hi, my name is Felicia. How many of you have been tested for TB before starting school or starting a new job, especially in healthcare? According to the CDC, which is the Center for Disease Control and Prevention, TB is one of the deadliest diseases of the world. Statistics from 2016 state that 10.4 million people were diagnosed with TB disease. 1.7 million were TB-related deaths. And in the United States, 9,272 cases were reported. Out of all the states that reported it, 4 were highest, which included California, Texas, New York, and Florida. I would like to inform you what TB is, how it's diagnosed, the different types, how it can be transmitted, and the different treatments available. At the end of my speech, you will have a better understanding as to why it's important that students and healthcare professionals are tested. What is TB? According to the definition of Merriam-Webster Medical Dictionary, TB is a chronic variable disease caused by a bacterium. There are 2 different types. There's latent TB infection, which is when the bacteria enters your body, but your body fights against the bacteria and it becomes inactive. And then the second type is TB disease. That's when the bacteria enters your body, but your body is not able to fight against it, and so then the person becomes an active carrier. 5 to 10% of the patients, of the people that have the latent TB infection will develop TB disease in their lifetime. The way that it's transmitted is airborne transmission, and the only person that is able to infect another person is an active carrier of the TB disease, and it's transmitted by coughing, speaking, or singing. Now that I've informed you what it is, the different types, and the transmission, I will be discussing the different symptoms and how you're able to diagnose it. Latent TB infection does not have any symptoms at all. So the person that has the bacteria is inactive but doesn't have any symptoms, so they don't know that they have the infection. Now, TB disease does have different symptoms, which include coughing, coughing up blood or sputum, chills, fever, and loss of appetite. There are many different ways that you're able to diagnose it. The disease, the most common is the TST test, which is the tuberculous skin test. That's when the tuberculin protein is injected subcutaneously in the inner forearm, and within 48 to 72 hours, it's verified to see if it has a reaction. Another test that can be performed is a blood test. Now, if either of the two have a positive reaction or a positive result, then that's when they're able to do the chest x-ray or the sputum smear or culture. There is a new test that was introduced in 2010 according to the World Health Organization. It's called Expert, and that's a rapid test where they're able to detect TB and also a resistance to the medication within 2 hours. And in 2016, 6.9 million cartridges were distributed globally to be able to use that as a diagnosis for the disease. Treatments. For latent TB, there are different treatments available, different medications, and it can take 3 to 9 months. It can be used in single or multiple medications at the same time. For TB disease, they use the same medication as for the latent TB, including other ones as well, and that can take 6 to 9 months. If not taken correctly, the person may become resistant to the those medications. There are other ones that are able to help, but they can become resistant, and it's very difficult to treat and very expensive as well. Now that I've gone over the treatments, I will enter my conclusion. So TB is one of the world's deadliest diseases. There are two types: the latent TB infection, which the person doesn't know that they have it and is not transmittable, and then the TB disease that is able to be transmitted from person to person, and that the TB disease does have its symptoms. There's treatments. It has to be a strict regimen. If not, then they become resistant to the medication. We are able to work together to bring awareness for TB. March 24th is World TB Day, which different organizations come together to raise awareness for TB, and also to work together for elimination of the disease, and we can be a part of it. Thank you.
Yay.